In this recording, I'm going to show you how you register a new client in EHR. I'm assuming you've already gone through the process of registering a new account and you are now able to sign in. So we're going to go straight to signing in. We sign in using a username and a password. This will take us to the home page. In order to do registration, you go to Workspace, Reception. We encourage you to search for each and every patient first before registering them to avoid duplication of names and duplication of effort. So in order to search, you search either using the first name or the last name. We want to register a client with the name Joseph Gumbo. So you search for either Joseph or for Gumbo, and the system is saying there is no record found for this particular person. So it's okay to continue and register this person as a new client. Register a new person. The identifier is any form of formal documentation that is accepted or allowed to be used as an identification document, which can either be a passport, a birth certificate, a national ID, or a driver's license. So if a person has a national ID, you select national ID and you type in the national ID number. If a person has a national ID but they do not remember the national ID number, you still select the national ID and leave the national ID number blank so that when this person brings their documentation, you can always edit and fill in the missing information. I'm going to assume this one has a national ID but they forgot the national ID number. The last name, like we said, is Gumbo. The first name, Viewer, this is a male. The year of birth, 1982. Month, September, on the 6th. After entering this basic information, you check for demographics. This is to check if there is any person in the system with these details. The system is saying there is no record found for this person, so you can click OK and continue to register. When you press register, the system is going to fill in the information that you've already provided and leave the blank spaces for you to fill in the information that is requested. The self-identified gender of this person, I'm going to assume for now, he's male. So you fill in the information, communicating with the client and asking the questions in order to be able to fill in the correct details of the client. The boxes with drop-down arrows, you just drop down and select the valid option. The boxes with add options, you have to add and search for the correct selection. I'm going to assume this one is a Zimbabwean, born in Zimbabwe. After filling in all the relevant details, you press next. Once you press next, it's going to take you to this window asking for contact details. Depending on the health facility, some areas use schools as addresses, some areas use house numbers and streets. So make sure you fill in every box necessary in order to be able to get the correct address of the person you're registering. If you can't see the town or the place that you want, you can always type a few letters, at least 3, and the town or area will appear. After filling in the person's address, you can save. This is the overview of the registration window. As you can see, we've gone through the demographics and the information is already there. We've gone through identification. Because there's no ID number, the window is blank. The contact details, we've only managed to fill in the physical address. There's no email address and there's no phone details. In order to add the phone details, you just click on this plus sign and you fill in the phone number and save. You can add as many phone numbers as you want using this plus button. This is where we fill in the email address if the client has by adding, and the system is going to be guiding you on how to edit a valid email address. Then we save. After filling in the contact details, we go on to relations. Relations are persons related or with the relationship with the client we're trying to register. So when you click relations, you add a new relation. You can either search this person from your database, just in case this person has already been at your site before, or you can register a new client. So in order to search, for example, let's say Mr. Tapiwa said he is a relation to the name Peter Moyo. You have to search first and see if there's a Peter Moyo in the system. If there's no Peter Moyo in the system, you can continue to register this Peter Moyo as a new person. There's a Peter Moyo already in the system, so we're going to select Peter Moyo view to make sure this is the Peter Moyo being referred to. So there's need for us to classify Peter Moyo and the relationship he has with Tapiwa Gumbo. Peter Moyo is I'm just going to assume that they are siblings. We'll also need Peter Moyo's occupation. Is he employed or not? Is Peter Moyo the next of kin of Tapiwa Gumbo? I'm going to assume yes. Peter Moyo is the next of kin. Does Peter Moyo have the same address as Tapiwa Gumbo? Yes, they live together. If they don't, we can select otherwise. After selecting all the details required, you can then save. So this is how we add relations to a new client. After relations, there is the medical aid button. If a person has medical aid, the system is also going to be requesting information about the members, the medical aid number, the expiration date, and the medical aid provider. So Tapiwa Gumbo has medical aid and he is the medical aid member. I'm just going to input a random number here, expiration date, select the correct year, 2022 in May on the 11th, medical aid provider. You add and you select the relevant medical aid provider. After filling in the required information, you can then save. This means that we've managed to edit information on all the required boxes. We can go back to the overview, and now we want to admit this patient to the relevant department so that they can get the services that they require. We can either admit as an outpatient or as an inpatient. The outpatients are those clients that we give same-day services. They come in, they get assistance, and they go back home. The inpatients are the clients that we take in and we monitor for a certain period of time within the health facility. If you're working at the outpatient department, you have to admit in the outpatient. So when you select outpatient, it's going to give you a list of queues that provide the outpatient services. All you have to do is to select the actual queue. For example, this person is coming for general consultation, so you send them to the general consultation queue. You press send to queue, and the system is going to tell you that the patient has successfully been sent to the next queue. If a patient is coming in for inpatient services, you select admit to inpatient, you select the ward they're going to be admitted in, and you send to this queue. After this, that's as far as registration goes, and the next person is going to be attending to this client will be attending to the particular queue that you have sent the patient to.